or silicone implants. Depending on the country, the surgeon and their popularity, they are used. Commonly what we use are the silicone gel implants. So here I'm going to talk about them. So when you select an implant, first we saw is how do you select the size of the implant depending on the base width of the implant. Now what are the other parameters? The profile of the implant, which means the projection of the implant, the curvature that is given by the implant. So they can be low, medium or high profile implants. So with the same base width and the same volume, you can get different types of profile views, that is from low to high projection, depending on the patient's choice as well. The cohesiveness of the implant. So from this comes the gummy bear nature of the implants. So whether they are again low, medium or highly cohesive implants. Then the shape of the implant. So we have round or we have the anatomical, that is the teardrop shaped implants, again depending on the surgeon's preference. We have the texture of the implant, that is the surface, whether it is smooth, micro textured or macro texture type of implants. Then how do you again select the size? So sometimes, like mentioned, the same base width can have different projections as well, can have the same volume as well. So there are a couple of sizers available which the patient can place into their normal bra and get a feel of the size and the projection of the implant. So certain sizers are also available for helping decide the type of implant. Usually we believe that when there is about 150 to 200 ml increase in the volume given by the implant, it helps to increase the cup size by 1. That is, if you are going from B to C, there will be an additional 150 to 200 ml increase in the volume of the implant. Now the pocket of the implant. So the implant pocket is subfascial, as previously said, a subglandular. Then there is subpectoral, which is below the pectoralis major muscle, or you have dual plane when you have a combination where on the upper pole it is covered by the muscle and in the lower pole it is by the fascia. So this is again dependent on certain factors on how you choose the type of the implant and the pocket for which it is used. Further, about the approach of the implant depends on from where you are inserting the implant, which can again be through the axilla, through the periareolar region, through the inframammary fold, which is the most popular and common one, and through the umbilical region, which is also known as tuba, that is the transumbilical breast implant. So now how do you decide the pocket? You decide it by the upper pole pinch test. So the upper pole of the breast tissue is pinched. If that has more than or equal to 2 cm of breast tissue, then you can select a subfascial pocket. If the tissue is very thin and less than 2 cm, then you need to place the implant below the muscle, that is in the subpectoral pocket. Otherwise, it can show through the skin, it can cause problems with the skin, and therefore the selection of the implant pocket is based on the upper pole thickness. Now the most important aspect here is the IMF, that is the inframammary fold. That is why in the first video we saw that we have to measure the nipple to the IMF distance in the relaxed as well as in the maximal stretch position. So this distance is usually considered as half the projection of the implant plus half of the height of it. So why are we considering this? Because this can further help us to determine the type and the size of the implant. So if the nipple to IMF distance is about 7 cm, then the base diameter, that is the base width of the implant, is usually taken at 11 cm, which can have a starting of 200 cc of volume. If the distance is 8 cm, it can accommodate an implant with 12 cm base width and volume of 300. Again, plus 1. If it is 9 cm of distance, then we can have a base width of 13 cm with a volume as high as 400 ml. This helps to give us a rough idea as well on how to select the size and the volume of the implant.